the local, national, and making international connections has provided me a lot of opportunities for networking and opening many new doors for other positions, including considering running for the board of directors member at large position for ONS this past year.
When we look at people in our lives and they are in leadership positions, whether that be locally or nationally, I think that they are good resource people for us when we have questions about pursuing that same direction.
It takes only one chance to really get to where you're going, and you may fail along the way, and those are all learning experiences that are going to make you stronger.
You're listening to the Oncology Nursing Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello and welcome to the Oncology Nursing Podcast. I'm Lori Brown, ONS Executive Director and your host for the fourth episode in our podcast series in Getting to Know Your ONS Board. Check out the first 3 episodes by accessing the link in the episode's notes. You can also earn free NCPD contact hours by completing the evaluations we've linked in the episode notes. Today's ONS Directors at Large, Deborah Allen, who goes by Hutch, Chris Mathey, and Jeanene Robison, who goes by Gigi, are joining me to talk about their experiences in oncology and with ONS. They'll share perspectives from their roles on the ONS Board of Directors and their role of diversity, equity, and inclusion in ONS's leadership, among with other topics. Thank you for joining us today, Hutch, Chris, and Gigi. Let's begin with your career background in oncology nursing and how it's shaped you into the nurse you are at your institution today. Hutch, would you like to start us off?
Certainly. And thank you for having us today. We're all very excited about being here and being part of the board and our first year experience on this 3-year journey. When I began in nursing over 40 years ago, it's hard to believe, the community hospital that I worked in did not have specialty units. As a matter of fact, the first oncology specialty units were just forming in larger academic medical centers at that time period. So I worked on a medical surgical unit that also took care of patients with cancer diagnoses, and they could be anywhere in their journey from time of diagnosis. We're putting them through their diagnostic procedures or having problems with chemotherapy, because back in those days, patients still got admitted for chemotherapy, or having surgery to reduce their tumor burden. So within a couple of years of my nursing practice at that community hospital, I transitioned to a different hospital and I began working at Duke in North Carolina. And I started working on a floor, believe it or not, that was specializing in psychosomatic medicine. I thought I wanted to be a psych nurse. So I wanted to keep my clinical skills very up to date. So I actually worked extra shifts, sort of like in our float pool, on medical surgical units at Duke. And there was, right next to my psychosomatic medicine unit, there was the oncology specific unit. So I actually started working there. And at that time period, we mixed our own chemo. There was no chemo certification cards. So yes, even float pool nurses could mix chemo. No hoods. We did all the bad, wrong things. I took care of oncology patients from the time of diagnosis. And we even had in that specialty unit, we had the new bone marrow transplant patients. So we saw a lot of GBH at that time period as well. And I absolutely loved it and learned that I really did not want to be a psych nurse, but I do use those skills to this date. So it wasn't until I started working in neuro ICU a few years later that I learned and found the patient population that I wanted to work with for the rest of my life. And that's neuro-oncology. So I specialize in patients with brain tumors. And that is still the center of my cognitive functioning research. I've worked in a variety of staff nurse over the years, especially the 40 years that I've been at Duke, in medical units, surgical units, ICUs. I was even a flight nurse. I have both my clinical nurse specialist and nurse practitioner advanced practice licenses, and I use all of those role components today in my work as the Director of Nursing Research and Evidence-Based Practice for the healthcare system. So, and I still practice as a nurse practitioner once a month at our community hospital's weekend symptom management clinic. So that's where I started in oncology.
Thank you, Hutch. Chris, do you want to share your story next?
Sure. A little bit about me and my journey is, as far as I could remember, I wanted to be an oncology nurse. Actually, I wanted to be a pediatric oncologist. Apparently, I wrote that on some school assignment in third grade, and I'm not with pediatrics and I'm not an oncologist, and I'm grateful for both of those and grateful that they didn't pan out. But I knew from a young time that I wanted to do something with oncology. So I went to the Ohio State University for undergrad, and they had the James Cancer Hospital there. And so I started working as a patient care associate, or essentially a nurse's aide, during undergraduate on a solid tumor unit that also had pediatric patients. When I graduated with my BSN in 2005, I stayed on that same unit and worked as a staff nurse. So this was a solid tumor medical oncology progressive care unit. And it was actually on this unit that the CNS said to me one day, "Hey, Chris, you have a lot of energy. You should come to this meeting with me." And lo and behold, it was actually a CCONS, or the Columbus Chapter of Oncology Nursing Society, board meeting. And all of a sudden I was membership chair. And that was kind of the start of my ONS journey, but we'll get to that a little bit later. I loved being a staff nurse. I still love being a staff nurse. I thought it was awesome. And I loved the people I worked with. I loved the patients. But I had a little bug that I would want to progress my schooling. I really also loved structured education. So I randomly took the GRE my senior year of undergrad and applied to grad school to be a family nurse practitioner, because I wasn't sure kind of what age I wanted to do. I just knew I wanted to stay in oncology. And at that time, we didn't have the acute care program. So I took 4 years to graduate because I wasn't in a rush. And I graduated as an FNP in 2009. I ended up staying at the James, and I worked in an inpatient medical oncology service with the same patients, pretty much on the same floor that I worked as a PCA and as a staff nurse. So maybe I didn't like job interviews, and it was where I was comfortable, but I also loved the people and loved those solid tumor patients. It was my dream job. It was what I had wanted all the whole time. It was the Oncology 2 service. It was what I saw myself doing. And I really never thought I'd leave there. But lo and behold, some of you may know Ohio State has a decent football team, and I have season tickets. And I sold my season tickets to one of the outpatient nurse practitioners one day. And she said, "Hey, Chris, you should come out and work with us." And I was like, "I'm not going outpatient. I work 3 days a week. This is lovely. I am staying inpatient. I like the acute care setting." But the more I thought about it, this was with GI medical oncology, which is the pancreatic, the esophageal cancer patients, the end-of-life care patients I'm caring for in the hospital. And I thought, you know what? Those are my favorites. Those are the people I really like caring for in the acute setting. How can I really make a difference? Maybe this is a sign where I can get to be more specialized and work within them in the ambulatory setting. So I actually did end up applying and interviewed and took a huge leap of faith, left my cozy home on that inpatient unit. And in 2013, I transitioned as a GI medical oncology nurse practitioner, specializing obviously in GI cancers. Then in 2017, I transitioned to more of an administrative role as a APP, or advanced practice provider. So your nurse practitioners and your physician assistants educator. And in that role, I continued to practice clinically with GI Med-Onc, but I also influenced the APPs at the James with educational sessions, started getting really involved in our fellowship program. And in 2021, I actually was promoted to APP manager and APP fellowship director of our fellowship program here at the James. So this is a job I have currently, and I absolutely love helping to get new nurse practitioners and physicians assistants excited about oncology and their transition to practice from school and those quick clinicals you have to really being a fully functioning provider. Moral of the story is you really never know where life's going to take you. And that's the great thing about nursing and oncology nursing, because I really never thought I was going to leave inpatient, and I never expected I'd be where I am. But here I am. There's been a lot of wonderful experiences. So that's kind of my journey with oncology nursing right now.
Thank you so much, Chris. Gigi, can you share a little bit about your career background and what brought you into the role you are today?
Sure. I have been an oncology nurse for 40 years now, and I have also really loved this journey. I began my oncology nursing career as a student nurse at Cincinnati Children's Hospital And I worked on a family-centered unit, and I cared for an 18-year-old young man with osteogenic sarcoma who was newly diagnosed. This experience was hook, line, and sinker for me, and it's where I began my oncology nursing journey. I applied for the staff nurse position at Children's Hospital and began my first job as a staff nurse on a pediatric oncology bone marrow transplant unit in 1982. And similar to what Hutch mentioned, there was no national certification for chemotherapy administration. In fact, I recall the physicians gave the drugs IV push and the nurses supervised the physicians in giving the drugs. So that's kind of interesting. And there were no immunotherapy drugs at that time. There was an oncology clinical nurse specialist at this hospital, and she was my role model. I thought, I think I would like to do that role. And so I would like to pursue some additional education to move in that direction. So I applied to and I attended Case Western Reserve University in Cleveland, Ohio, starting in 1986, and I earned my master's in oncology nursing. I decided to pursue adult and not pediatric oncology nursing because my family is all from Cincinnati, and I wanted to live in Cincinnati, and there's only one oncology pediatric clinical nurse specialist position, and I thought there would be more opportunities in adult oncology. I also met lots of oncology nurse mentors while I was at Case Western, including Benny Martocchio, who was my professor, and Sue Schneider, who was my preceptor at University Hospitals of Cleveland, and she later became president of ONS. I started my first job as oncology clinical nurse specialist at Jewish Hospital in Cincinnati in 1990, and it was there that I learned the roles of the clinical nurse specialist, which included clinical consultation, education, administration, and research. In 1993, I accepted a position of oncology clinical nurse specialist at Christ Hospital in Cincinnati, Ohio. And I worked in this position for 26 years, and I enjoyed multiple activities in this role, including I created an oncology nurse residency program. I chaired the pain committee, and I chaired the blood policy subcommittee. I created an acuity system for inpatients in the EMR, and I facilitated research for our massage therapy and yoga therapy program. In 2020, I accepted a position as oncology clinical education specialist at St. Elizabeth Healthcare in Edgewood, Kentucky. I have created several oncology nursing education programs in this role, including an oncology nurse fellowship program, an oncology nurse certification review course, and a basics chemotherapy and immunotherapy administration course. So it's been a great journey, and it continues.
Thank you each for sharing. One of the common threads that I'm hearing from each of you in your journey, and I've actually heard it among many of the oncology nurses that I've had the opportunity to speak with, is this theme about a calling and a passion. And it's so fascinating to me that in this industry, specifically for the oncology nurses, that's a common thread for many in the profession. And it's such a blessing for each of you that can identify that, because it's not always something that people get to identify throughout their career. It's not always known for everyone that it is their calling. And I meet people in their 40s and 50s and 60s, and they're still wondering what the right thing is for them. So I think it's such a wonderful thing that you've all found that. I think it's great for the patients as well. So thank you for sharing your journey. Let's talk a little bit now about your involvement with ONS. Tell me about your first experience. How did the history of your participation at ONS maybe lead you into the board? Chris, do you want to start with yours?
Sure. Thanks, Lori. So I kind of mentioned it a little bit before about Polly James, the CNS on my unit, who invited me to my first CCONS, or Columbus Chapter of Oncology Nursing Society meeting, which was the board meeting. So that was kind of my introduction into ONS and CCONS. But over time, my involvement with CCONS at the local chapter was great. I think I've served every position on the board except for Kaleidoscope, which is our big spring conference chair, as well as treasurer, which I don't think you really want me to do either one of those. But I remember going to ONS Leadership Weekend when I was our local president, which I was president from 2012 to 2014. And at that time, I had just had a baby. So I'm not sure if it was 2012, 2013. There's several years in there that were all a blur, but I was at ONS Leadership Weekend, and I remember one lady there was talking about her involvement on the board. I think she was a treasurer. I have no idea what her name is because I am horrible at names, but I could pick her out of a crowd. And I remember going up to her afterwards because she had said that she had gotten involved, she had had babies, was continued to be involved in ONS. And it was that kind of aha moment. And I told her, I said, thank you for making me feel like I'm not crazy and that I can do this. I could have a family. I could have a job. I can do a little bit of it all. And so it was someone that I've never forgotten. I've seen her at Congress kind of here and there. So I really should know her name. But it was that you never know who's really going to give that spark in your life. And she was someone that kind of helped with that. So over time, my kids are 10 and 12 now. I'm still involved. But in 2018, after being really involved locally, I decided I wanted to get a little bit more involved on the national level. This is when I applied to be part of the Congress content planning team. I had seen an email that mentioned, do you want to help plan Congress? And I thought, this sounds amazing. So I applied, and lo and behold, I was chosen. And that was one of the coolest experiences that I think I've done thus far. So I was on the Congress content planning in 2018 and 2019, so right before COVID. It really sparked that national interest in me. And that's what came in 2021. I decided to apply for my intent to serve on the board. I did have a local member, Bertie Ford, who had talked to me about, Chris, you should serve on the board. You should serve on the board. And for so many years, I was like, there's no way I'm ready for that, nor do I know what I'm doing. But it was that planning team that really took that interest to the next level. So after multiple essays, videos, and interviews, here I am, and I'm honored to represent oncology nurses as well as my local CCONS chapter.
Thanks, Chris. Hutch, what about you? Can you tell us about some of your first experiences that led you to the participation on the ONS board?
Yeah, certainly. So it actually does date back to when I became a nurse practitioner in my first outpatient clinic, which was at the Preston Robert Tisch Brain Tumor Center at Duke in 2000. So I was well into the first 20 years of my practice, but I joined ONS just as soon as I moved into the ambulatory setting. I had actually been a very active member of the American Association of Neuroscience Nurses, which also has a neuro-oncology section. So being inpatient, I had predominantly worked with neurosurgical patients and had focused neuro-oncology within that organization and learned more about ONS when I moved into the ambulatory setting. So that's an interesting thing for us to keep in the back of our mind, is to reach out to all of our inpatient specialty unit nurses as potential members. But I joined ONS immediately, and I actually became certified as an advanced oncology nurse practitioner the first year that AOCNP was offered. And so my chapter is the Triangle chapter of ONS, my local chapter, and they immediately reached out just as soon as I started going to meetings, made me feel very welcomed, and they actually asked me to run for office. And even though I felt like I didn't have enough oncology experience, I went ahead and said yes. I needed somebody to run. I don't say no very often. I did lose the first time I ran for president. That didn't dissuade me. I actually stayed active, worked on some committees, began welcoming other members, just like members had welcomed me at meetings. And I eventually served on my local TONS board and became president. I've worked in a variety of board opportunities and served as their leadership committee co-chair, which we developed very specialized programs to offer abstract writing workshops, poster development workshops, and presentation skills workshops after clinic and work hours to members so that they could submit ONS abstracts and learn how to present for ONS. And that's been widely successful over the last 7 years. This committee led us to develop a very specialized program, which I wrote in one of the ONS chapter newsletters about as our posters on parade. So all members who present any poster throughout any conference, locally, nationally, internationally, can present their poster at a Posters on Parade. And this is us celebrating all the work that we do as oncology nurses and disseminating that across all of our workspace in the Triangle region. I also have served as the CNS team lead for the first cognitive impairment PEP team. And believe it or not, most of us who were on that original team still remain active reviewing this literature. And we're looking forward to hoping that we get to write a guideline and update some of this literature very soon. But we've been working on this since 2011. So this is a very dedicated group of nurse researchers working in cognitive function and helping nurses recognize cognitive impairment in our patients and the interventions that are necessary for nurses to guide our patients through to improve their cognitive functioning. I've also participated in the ONS Researcher Intensive, which was produced by, I believe, the foundation, and it helped provide budding nurse researchers like myself after I got out of school with my PhD, the training and feedback that we needed to create a solid foundation for our research platforms. And that's where I really started to get some additional feedback and networking across the nation for cognitive function research. All of this said, taken together, the local, national, and making international connections has provided me a lot of opportunities for networking and opening many new doors for other positions, including considering running for the board of directors member at large position for ONS this past year. So I think, just like Chris has said earlier, just be open, keep your mind open, be willing to listen and accept new opportunities.
Thanks, Hutch. One of the things that you just mentioned in there in the early part of your journey is that you weren't elected on your chapter board initially. So I think that's important. Thank you for bringing that forward. I think it's good for the listeners to have that opportunity to hear that. And a lot of times we hear people, whether it's at a chapter level or at the national board level, they aren't maybe getting elected the first time and they are persevering and coming back a second time. And sometimes, there is some additional experience to be gained, and other times it just maybe wasn't the year, but to have the courage and the perseverance to come back is important, because we're so happy to have you here. I'm sure your chapter was excited when you had the opportunity to serve there as well. So thank you for bringing that forward. Gigi, what about you?
My first involvement in the Oncology Nursing Society was when I attended the ONS Congress in Denver, Colorado, back in May of 1987. I learned about the value of networking with my colleagues in oncology nursing, and I experienced the excitement of being at a convention center with thousands of other oncology nurses to learn all week long. I really valued being a lifelong learner, so this was really a dream for me. In 1989, I moved back to Cincinnati and I joined the Cincinnati Tri-State chapter of the Oncology Nursing Society. And immediately I jumped in, and first I said I will be chairperson of archives, and then I ran for the board, and then I was secretary. And over the years, I have been, same as Chris, I've been in every position except for treasurer. So I've been director at large, I was president. I've been involved in our program committee because I really think that that is a great benefit to our chapter members to have educational programming that they are really interested in. So I choose to put my time in that. And I also like finding speakers and program topics that our membership will be interested in. And I've also chaired multiple committees in our local chapter, including our nominating committee, which I really enjoy that because it includes the awards, and we give out a Pearl Moore Career Development Award to one nurse, and we give out an Excellence in Oncology Nursing Award. And I love recognizing our colleagues for the great work that they're doing. Nationally, I have enjoyed participating in ONS in multiple ways. Like Hutch was on the ONS PEP team, I was also the facilitator for the ONS PEP team for skin reactions back in 2009 and 2013. Our team actually reviewed articles, I think, for another 6 years, but we have not continued. I was the editor and the author of the Skin Reactions chapter in the ONS Putting Evidence into Practice book, which one of the benefits of getting involved in a national committee is there may be an opportunity for publishing along the way. I was a presenter for the ONS chemotherapy and biotherapy course starting in 1999 and continuing until 2013. And I have attended many, many congresses over the years, which I love for many reasons. And I have presented multiple podium and poster presentations. And this has been a really great opportunity to share my knowledge and to meet others who have similar professional challenges. I have attended several ONS leadership weekends that are for chapter leaders. I was on the ONS Continuing Education Approval Review panel for like 15 years, and I reviewed CE applications. I've been a reviewer for multiple ONS awards over the years. And I was a fellow at the ONS Leadership Development Institute back in like 2000 and 2001, which was a really great experience. And I think that's when I first met Brenda Nivajan. I was a member of the Advanced Practice Nurse Retreats online service and education team back in the day. I've been a member of multiple special interest groups with the ONS, including the Clinical Nurse Specialist Group, the Chemotherapy, and the Pain SIG. And I've been a writer, an item writer for ONCC for test questions. So along the way, I have received support from many oncology nursing colleagues. In my local chapter, some of my mentors have included Ruth Goltz and Debbie Heydrich, and they have been role models for me in expanding my professional activities at the local, state, and national level, including publications, presentations, and committee involvement. Ruth also inspired me by her involvement in the Leadership Development Institute with the Oncology Nursing Society and by her election to the ONS board. So I think that's something else to think about is when we look at people in our lives and they are in leadership positions, whether that be locally or nationally, I think that they are good resource people for us when we have questions about pursuing that same direction. Another person who was a resource person for me was Mark Irwin at the Oncology Nursing Society when I was on the PEP team. And she was a great role model related to helping to categorize interventions into different levels of evidence. Susie Newton was another mentor for me, and Susie has served in multiple capacities in ONS, including ONS Leadership Development Committee. Susie's also the editor of a book that is called Oncology Nurse Advisor, and she's provided me with opportunities to write a chapter for this book over the years. And so as time has progressed, my kids are grown now. Their ages, youngest is 23, oldest is 34, and I have 7 grandkids. So as an empty nester, I felt like it was a good time for me to use my time and talents for the ONS board. And I actually applied 2 years ago, and I received the phone call that I was not chosen to be one of the 6 people who was going to run for the ONS board. And then I received a phone call in May of 2021 that said, we would like for you to apply to the board. I said, okay, well, I'll reapply. And I did. And then I was chosen to be one of the 6 that was on the ballots. And then I was elected and I was thrilled to death. So there's many stepping stones along the way. And I would say, take a risk and just keep moving forward.
Thanks for sharing, Gigi. We've heard from each of you about your career backgrounds and your participation leading up to the board. Let's spend a few minutes talking about your first year on the board. What was that experience like? What's the individual role that you've played? And maybe were there any surprises that you experienced thus far? Gigi, why don't you start us off for this one?
Sure. I have really enjoyed my participation on the ONS board this year. I have been a member of ONS for 35 years, and I cherish my experiences and friendships with my oncology nursing colleagues over the years. And being on the board has been the cherry on top. It's just been a dream come true for me. So as new board members, Chris and Hutch and I were invited to be part of the strategic planning meeting with the current board in February. And that was a unique and amazing opportunity for us to collaborate with leaders from the Oncology Nursing Society, the Oncology Nursing Certification Corporation, and the Oncology Nursing Foundation. And we were just together brainstorming strategic planning ideas. One of my most memorable moments was sitting at the same table with Nancy Houlihan and talking about the mission and vision of the Oncology Nursing Society. I thought that was a very unique moment. Other fun activities was Hutch and Chris and I rode down the lazy river on some inner tubes, and that was quite a sight and a fun experience for all of us. In April, we attended the ONS Congress in Anaheim, California, and we had multiple opportunities for board get-togethers. And one night, we had an ONS leadership dinner, and I had an opportunity to catch up with Sue Schneider, who was past ONS president and my old preceptor from Cleveland. In May, we had our first in-person meeting at the Pittsburgh ONS office. And in the past, I had toured the ONS office and I had seen the ONS boardroom. And in May, as I sat at the ONS board table, all I could think of was, wow. In September, we attended the ONS Hill Day in Washington, D.C., and that was a unique opportunity to visit with our legislators. Currently, I'm on the position committee, and in that committee, we review various proposed position statements for ONS, review applicable literature, and we may update position statements that have already been approved. Hutch, Chris, and I also led efforts to initiate a letter from the board column in the ONS chapter leadership newsletter, which Shannon Holzer facilitates. And this has been a nice opportunity to write our thoughts and our ideas to support chapter leaders in their ONS leadership journey.
Thank you. Chris, tell us a little bit about your first year.
Gigi summarized a little bit of the activities that we've done very well, and my involvement as a first-year board member has been amazing. I actually came into it not totally knowing what to expect, but as Gigi mentioned, that first meeting that we went in February to help work on the strategic plan, I think Hutch, Gigi, and I had contacted each other beforehand, so we had developed a little bit of a relationship. But I fully expected us to come into that meeting and we'd be put in a corner table as the new board members and just kind of sit there and do your thing. But we were really the inclusiveness and really bringing us all in and the welcoming. And we weren't new. We were part of the group was really amazing. And I think from that moment on, my eyes were open. Someone from work actually asked me how things with ONS boards going last week. And I said, you know what? I love it. Everyone's so welcoming. Everyone's so motivated. Everyone's so here for oncology nurses and for our oncology patients, which is a huge passion of mine. So one of the things that I've really enjoyed in the past several months of our board involvement, as well as our meetings and our monthly meetings, is ONS Hill Day was really an amazing opportunity for me. It allowed us time to meet with the other ONS board members and get some of that time outside of just our meetings that we walked around Washington, D.C. But one of the coolest things that I also enjoyed was meeting other ONS members in general and making those contacts and going to the Hill with constituents from all over the country and really making a difference. Because of our involvement at ONS Hill Day, the Lymphedema Treatment Act has now passed in the House, and we're waiting for it to pass in the Senate. And I really think that that small step that we took as an advocacy group with ONS really made a difference. And so that is something that I've been extremely proud of. But I think that inclusiveness of the board and just the welcoming of everyone, I've enjoyed every single minute of it.
Great to hear. Hutch, what about your experience?
So I'll say, first off, ditto what Gigi and Chris have already said. All of the board members have been wonderfully welcoming, very inclusive, allowing everyone to operate at the same level playing field as we're walking in the door. Everybody's been very thoughtful about preparing us for this 3-year journey. I love that within our own board, there's a leadership development program committee that really helps us become better board members and provides us a mentor to guide us through this 3-year journey to help us answer some of the questions in between meetings. I also love that we have a lot of time in our meetings to learn how to work together as a team while also acknowledging our own individuality. And so that brings additional meaning and permits our experience to be part of the vision while forming all of this together as a team, a cohesive outcome from the ONS board for all of our members. So I am on the positions committee with Gigi and established board members Patty, led by Teresa, in which we review the ONS position statements, which ones need updating, as well as working with groups to develop new statements for ONS to consider. And one of the things, if you ask me what's the thing I cherish the most at this point in time, is the close relationship that us newbies, Chris and Gigi and I, have formed as soon as we came in.
Agreed.
One thing that I think has helped me on my board, and this has helped when I was involved locally, that very first meeting Polly James took me to, is that everyone talks in acronyms and abbreviations, and I had no idea what they were meaning. And so I remember my first local meeting, I kept asking, what's that mean? What is that? And I've brought that perspective to ONS as well, and having that openness to ask questions and kind of that spirit of inquiry, always questioning, because if I'm wondering something, someone else is wondering kind of the same thing, or at least that's what I'm telling myself to make myself feel better. But constantly asking questions just for clarification, because in nursing in general and healthcare, we use so many abbreviations that I don't always know what all the LMNOPs mean. So that's one thing that's also helped me on the board.
Thank you all for your comments. As you all know, the diversity, equity, and inclusion is a large part of the work that we're doing here at ONS. And the board of directors is striving to ensure that we have a diverse group of individuals, really paving the way for the organization. Can the three of you share how your backgrounds have aided in the board service? And what advice might you offer for those who are thinking about running for the ONS board of directors or any of our leadership committees or groups? Let's go ahead and start with you, Gigi.
My background has aided me in my board service because I have worked with multiple boards, committees, and task groups in the past. I have worked with interdisciplinary teams and non-healthcare providers to obtain a broader perspective in developing effective solutions to issues. Team members that I work with may include persons who have various educational levels and various ethnic and cultural and religious backgrounds. I also teach educational programs, and I'm very sensitive to include diversity in my content and my visuals. I have diversity in my perspectives and my thinking. In my work at healthcare facilities, I have a systems approach, and I value interdisciplinary participation. My advice for anyone who is thinking about running for the ONS board or any other leadership position is to be open-minded and to think outside of the box. I believe that it is crucial to listen to as many people as you can in order to have a diverse perspective.
Thank you. Hutch, your thoughts?
Like Gigi, I have been a member of other state level boards for nursing organizations and interprofessional groups. For instance, right now I'm a co-chair of an international group, and we're writing a systematic review on cognitive rehabilitation strategies in cancer patients. And you really learn within these groups that language is not the same, okay? And what may sound like a word that you use within your own culture may not have the same meaning in other cultures. So it is important, like Gigi said, to really listen, and sometimes asking that difficult question or even providing difficult feedback or just saying, let's clarify. I need to understand where you're coming from. I'm not an expert in DEI, and that is where I think I sometimes struggle with this, because I think I should be an expert and that I should know the answer to everything correctly the first time. So I think it's harder to step back and say, I'm not the expert, but I am a lifelong learner. I love finding that aha when I learn how to apply it into my life and into my practice. And I think that's the most important thing of becoming a board member, and just always saying to our members is that I need to step out of myself and keep an open mind and listen and provide feedback.
Thank you, Hutch. Chris, what about you? What advice might you have for anyone that's focused on a leadership journey?
Thanks, Lori. I think just being open to different perspectives and keeping that open mind. And like I mentioned earlier, the spirit of inquiry. My mom's very active in her local nursing professional organization. So I had that from a younger age, knowing and seeing that involvement. And I remember an interview that someone looked at my CV, and this was the interview for my educator position, and said, "Why do you do everything that you do?" And it kind of took me back for a second. I was like, well, I don't know. It's part of my DNA. It's just what I do. And I think it's okay not to have a total answer about that. But I think all the things that I have been involved in, I've taken something from and I've learned from, but also keeping that perspective. I work at a large academic medical center, and I am very well aware that the resources we have here are not available at your smaller community hospitals. I am extremely blessed to be able to have those resources and opportunities. So keeping in mind of others that may not have or have to be a little bit more resourceful and how we can reach them. I always thought the idea of mentorship was something that intimidated me. And I was always getting kind of stressed about, oh my gosh, do I need a mentor? Who's my mentor? Do I put a billboard on the highway saying, want to be my mentor? How do you do that? No idea. But kind of over the years, I've learned to just relax a little bit and do a little bit more what makes me happy, what I want to get involved with, look at the people around me. And like that treasurer who didn't realize that when she was telling her story made a difference to me, because you really never know what you're going to gain from the people around you. And that's what I've just kind of taken, and the perspective I've taken. So I too have really loved getting to know Gigi and Hutch and all the members of the board, as well as other members of ONS staff and members of oncology nurses around the country and world at large. But there's so many times that I have this imposter syndrome, and I have to tell that voice in my head of, I believe in myself, telling my inner voice that zip it and just continue on. But it takes only one chance to really get to where you're going. And you may fail along the way. And those are all learning experiences that are going to make you stronger. And so trust me, my road to leadership hasn't been all smooth and sailing and easy peasy, but it's been all of those experiences that I've taken and have kind of molded me into building a different perspective and being a hopeful, influential leader to bring me to where I am now.
Thanks, Chris. Great leadership advice. And I'd also offer to those listeners that if you are considering a leadership journey, absolutely think about reaching out to the Leadership Development Committee. You can find their contact details and a ton of information about the process on the ONS website. So just type in the search box, ONS Leadership Process webpage, and it will take you right there. Again, whether it's the early stages, if you're just considering, if you absolutely know this is the path for you, they're a great group to give you guidance and resources to help navigate that path. Well, this has been a great conversation. Before we wrap up, I'd like to ask you to share some of your favorite experiences from your first year on the board. What do you look back on and smile about? And what are you looking forward to in 2023? I will start with you, Hutch.
So the things that I smile about, I think I've referred back to them already, is really how welcoming the board has been. I will also say that at all of the ONS meetings, the Congress in April, as well as Hill Day, I was surprised, but also very appreciative of how many of our members came up and said, congratulations, and thank you for your service, and thank you for everything you're doing. I think that just having the welcoming experience from all the membership and the board of directors, as well as developing a close relationship with my newbies, Gigi and Chris, have been the most rewarding experiences so far.
Thank you. Gigi, what about you?
Well, I agree with Hutch in relation to the welcoming experience. I think that has been very valuable. We also were assigned a board buddy, and the board buddy is another person on the board who has been through this before, and so they can help answer questions, and that's been very valuable. One of the things I have also enjoyed is just being around some amazing oncology nurse leaders. For example, at the November meeting, at our board meeting, we had a breakout room, and Pearl Moore was in my breakout room, and that was amazing. I also like the fact that we have professional development activities at each meeting. One month we did one on our different personalities. Another month, it might be more about your leadership skills, improving your leadership skills. I think one of the things Hutch mentioned earlier, which I'd like to repeat, is that as a board member, one of the things that we are told to do is really to think more high level. We are not in the weeds. And I did want to say a word of gratitude for the ONS staff, because they really help to implement different strategies that we may be discussing. For example, Hutch and I both serve on the physicians committee, and we will come up with all of our thoughts and ideas. And then there's a staff person at ONS who totally cleans up the position statement. So when we present it to the board, it looks lovely. And I appreciate that. So what do I look forward to in 2023? I look forward to more of the same. I look forward to continuing to work with this great group of ladies and men.
Thank you. Chris, any great experiences you want to highlight from your first year?
I think more than anything, over the past year, I've come through with the relationships. COVID's brought out a lot in all of us for healthcare and some self-reflection. I've realized that I'm very relational and relationships mean a lot to me. And that's something that I've really enjoyed this year. And I'm looking forward to continuing to develop those. My board involvement really fills my bucket and fills my heart and has really given me that extra on those hard days at work when I just want to scream sometimes. The involvement in this has really made a difference and helped me keep going. What I'm most looking forward to in 2023 is ONS Congress in San Antonio. I am so excited to get back to we got that in Anaheim and the feeling of having so many oncology nurses together, but I love Congress. It just gives me goosebumps thinking about it. So I'm excited to get back and see all those nurses again. So many people at my institution are starting to get notifications that their abstracts were selected. So I'm thrilled to be back in person, continue to be back in person. And I've seen some of the education sessions that are getting planned, and I think it's going to be another wonderful Congress, and I'm excited to see everyone there.
Thanks, Chris. I share your enthusiasm for Congress as well. I have been attending conferences for well over 20 years. My first Congress was in 2017. It was incredible. I mean, I think a few of you have mentioned the content and the expertise that you're getting there. And I think that's why people obviously are going, but what they don't expect to get that you're absolutely going to receive is that emotional connection, that energy. Like I said, I've never been to a conference that evoked so much for me. I came home from my first one and I remember telling my husband, I've never been to a conference where I cried. I had my heart melt. And then I also had my emotional cup filled all in like the same day. And it happened for a series of 4 days. It was really incredible. So I share your enthusiasm. I'm looking forward to it as well. Before we close out, any last minute thoughts or reflections that any one of you want to share with the audience?
I wanted to say thank you. Thank you to them for all they do for our patients, their families, and each other. And just thank you for being ONS can't be what it is without our own ONS staff, but also our ONS members. So thank you for doing what you do.
I would just like to say to all the people who are listening to the podcast is just take the first step. If you are not currently involved in your local chapter or in ONS in any way, just take a step and just move into a direction where you can get more involved and you will find great enjoyment and satisfaction in being involved in your profession.
And I just want to say, just do it. And that can be just as simple as reaching out to any of us. We're open to any questions, concerns, feedback. We want you involved. We want you engaged, and we will help guide you in your own leadership journey, no matter what that might be. We are leaders. We are advocates. We are nurses. We are oncology nurses.
Well said. Well, Hutch, Chris, Gigi, thank you so much for sharing your journey with us today. To the listeners who are wondering which path might be right for them, as you heard from each of our board members today, just lean in, get involved, whatever that means for you. If it's participation at your chapter level, engagement in the ONS online community, attending Congress, reach out to a past or a current board member, whatever it takes, just get involved. And I think your path will show itself. Thanks again, Hutch, Chris, and Gigi, and to our audience for listening.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.